Gender disparities in health. In the United States, women tend to have a longer lifespan than men, and that is basically starts at birth, where boys are have a much bigger chance of being born prematurely and of dying before their first birthday, and also more likely to have deformities. The longevity gap increases among minorities in the US. Women tend to live about 6 years more than minority men in the United States. Internationally, you also have a bigger gap between how long a woman lives and how long a man lives. It's about 7.5 year difference. And part of that is because a few different things, but the risky behavior of men, their behavioral factors amount for 54% of the reason of why they have a shorter lifespan than women. They tend to be more violent, involved in violent activities and smoking and alcohol, drinking and drugs. Their diet isn't usually as good as women are. They're not as fit. They don't like to visit the doctor. They don't get medical help unless, it's a dire emergency. Are also some social factors which account for 15% of the reasons why women live longer. There are also biological factors. So the second highest one there is the biological factors. I'm actually going to first talk about the biological factors, okay, that lead to men having a shorter lifespan. Obesity is a big issue for men. It gives them higher cholesterol, and it can make them have diabetes. Stress is another thing that does not help with the situation as far as for your health. If you have a lot of stress, you can get strokes, high blood pressure, heart attack, and again, make it easier for you to live a shorter lifespan. Stress, again, it's also a social factor that leads to men having a shorter lifespan. Men don't deal with stress as well as women seem to. Women have a bigger support system than men do, because men usually don't like to talk about their feelings, and they don't relieve stress in a healthy way. Again, with the risky behaviors, that kind of goes to one hand in hand. They tend to take out their emotions through alcohol or drugs or violent behaviors. Heart issues. Men are much more prone to heart issues than women are. Men tend to have heart attacks, more heart attacks than women do, coronary heart disease, and that's partly because they have more visceral fat. They're apple shaped, so their stomach area has more fat than women do. And women, except for women who have a lower economic status, they can have visceral fat and be more prone to coronary heart disease, or just as prone to it, just because they have a lower economic factor happening. Also, if you see this chart right here with heart disease, over the age of 65, men are also more prone to heart disease, 39%, and women are just about 26% more prone to heart disease, and that's partly because women have estrogen until they go into menopause, so that's why it takes a lot longer for them to have any heart issues, because their cholesterol is usually lower, and it gives them less heart problems because of it until they go into menopause. Now, doctors do tend to show gender bias because they do take it more seriously in men if they're having any heart issues than they do in women. They're more likely to send men to a specialist, a cardiac specialist, than they would women. So that shows a lot of gender bias. Other diseases or health issues that men are more prone to than women is pancreatitis, kidney stones, autism, and Parkinson's. That's just a few. of them. As far as women, women are more prone to have Alzheimer's, to get Alzheimer's, IBD, irritable bowel disorder, osteoporosis, migraines, depression, osteoarthritis, MS, UTIs, and celiac disease. Celiac disease is a disease of the small intestine. It's usually someone who's genetically more prone to have problems with their small intestine if they absorb the protein called gluten, which is found in wheat and in rye and in barley and so many other things. Usually that will damage the small intestine, the little villi, which are hair-like follicles that are in the small intestine. They help to absorb nutrients. And with a person that has celiac disease, if they ingest gluten, they are more likely to have their villi flattened and look like this, which does not help with absorption of nutrients and then causes different complications. And it's also actually kind of hard to diagnose someone with celiac disease, not just because the doctors don't check that unless you have a history and ask them to. There's also 300 different symptoms, and not everybody's the same, so it's hard to diagnose celiac. Some of the symptoms can range from having gastro issues like diarrhea or constipation, cramping, bloating, heartburn, nausea, vomiting. There's a lot of different gastro issues. You can also have issues with brain fog, not being able to focus as much if you ingest gluten, anxiety, depression, mood swings, behavioral changes, neurological disorders. You're also more prone to having issues with your reproductive organs, especially women. A lot of times women are diagnosed with celiac after they've gone through having issues with infertility or miscarriage. They get tested after, so many other things they've been tested for. They get tested for celiac, and that's how they usually will find out. But usually you can have issues with your body as well, very tired, especially if you're not absorbing nutrients because you've been exposed to gluten one way or another. You can have weight gain or weight loss. It depends on how your body wants to react to it. You can have bruising easier, hands and feet swelling, joint issues, and pain. It's a little bit different with kids. You can notice it early on if there's failure to thrive, like they're not growing. That's a sign of celiac. And now doctors are a bit more understanding of the disease, so they are looking into it more than they used to in the past. People with celiac disease can also have a lot of random things like teeth discoloration, sores on their mouths, muscle cramps, nosebleeds, more prone to nosebleeds. And once you have one autoimmune disease, you are more prone to get other autoimmune disease because they work in clusters. So if you have celiac, you can get rheumatoid arthritis, MS, ulcerative colitis, and any other autoimmune diseases, again, because you're more prone to it because autoimmune diseases work in clusters. You can also have problems with your skin, rashes, hives that you just don't even know why they got there. I was interested in this because I was diagnosed with celiac, and it was like a whole different world than what I was used to. I had to stop eating so many delicious things, and I decided to look into how more prone women are to celiac than men are. The other part that I wanted to look into, because we did mention that depression hits men and women, and also that people with celiac are more prone to depression. Women are usually more talkative, so they will seek for help when they're having mental issues, when they're feeling depressed. So you do see that 1 in 4 women will actually have depression, as opposed to 1 in 10 of 10 men having depression, because again, men are not as easy to take to a mental health specialist. They don't want to admit that they might have a problem. Women are also more prone to anxiety. 60% of the anxiety cases are found in women. Um, uh, Mental health issues that women are also more prone to are dementia, eating disorders, PTSD, but men are more likely to commit suicide, mainly because they do usually use a gun as opposed to pills, which don't, obviously are not going to have the same effect as a gun. So women are more prone to mental health issues, not just because of their genetics or their biology, but also because we will go and seek help when we need it. There are organizations out there doing research to try to close the gender gap that exists in health, to try to prolong longevity of men as well, and also to deal with the sex differences, because certain diseases, depending on whether you're a female or you're a male, react differently, or will stay longer than other diseases. So there are organizations you can look into. It's right here, Women's Health. The medical schools are looking into this to see how women and men react differently to different diseases and health issues. Now, how can we stay healthy to make sure that we are not going to have any heart disease or any other disease? Well, some of the things that we can do is that we can exercise regularly to keep a healthy lifestyle. Eat healthy, especially if you have celiac disease, don't have any gluten. You have to drink plenty of water, reduce stress, which I know is very difficult for anybody because both genders get affected by stress. Smoking, definite no-no for either gender or anybody in the world. Visit your doctor, get your physicals every year. Limit the alcohol consumption, but overall, be happy.